Reactive attachment disorder is a term used to describe a constellation of symptoms whereby a child has difficulty connecting with the people around them. They may withdraw, appear depressed, anxious. They do not readily make eye contact, reach out to people who are caretakers or loved ones. There's an inability in these children to regulate their emotions. You might see tantrums or rage that occurs when they're frustrated because they don't know how to ask for help. It is thought that children who have suffered trauma as a result of being brought up under difficult circumstances and adopted out, or being victims of or witnesses to family violence and such, that these youth may be at higher risk. But there is also the background of where the family and the genetics that come through are from, what the environment, early childhood and even prenatally looked like, and then what are the conditions at present under which a child is being raised.
I love my children. My children are a product of the hell that they went through. Yes. And it's not their fault.
All of the attachment comes down to trust. They don't trust anybody, and if they can't trust me to know what's best for them, they're going to fight to do what they want, and doing what they want looks like oppositional defiant.
Neither of my boys were diagnosed until the worst of the behaviors had already affected, and we had gone through everything we could think of to try and help, and we didn't know what we were dealing with until I started reading and said, you know what, this looks an awful lot like RAD to me.
The problem is that the children don't think the way we do.
Right.
And so the things that we would do to guide a 2-, 3-, 4-year-old doesn't work on them because they don't understand it.
I call it parenting upside down. With your other children, you're teaching them to become independent. These children have felt like they've been surviving on their own their whole entire lives, so they don't feel like they need anybody. So actually, to help them heal, you're having to teach them to be dependent.
Yes. For a family who is living with a child with this difficulty, the good news is there are evidence-based treatments. The current best practices is to get a very thorough diagnostic evaluation from a pediatric child psychiatrist, developmental pediatrician, and psychologist who can make recommendations for a comprehensive and interactive treatment plan that may or may not involve medication, but definitely is going to be a family-based intervention where not just the child is being taught certain ways of monitoring and managing themselves, but also the parents are giving good support in how to raise this child and work with the child. My best advice to parents who are struggling with a child who may have RAD or something similar is to get several opinions. I'd look at effectivechildtherapy.org as one place, and I'd look at the Academy of Child and Adolescent Psychiatry, the American Psychological Association, for their websites and information that might steer you in the right direction.